Welcome to the proper Cheetah sensor placement training for the Cheetah Starling SV. This presentation will cover the following learning objectives. Understand proper skin preparation for optimal sensor use. Understand proper placement of the sensors. Understand ways to improve sensor performance and recognize poor performance. One package of Cheetah sensors contains all of the materials needed for one application. The package contains 4 sensors, an instruction card showing how to properly apply the sensors, and skin prep. Note that the sensors can remain on a patient for up to 48 hours. Step-by-step instructions are also included on the instruction card. Here are the instructions for proper sensor application. 1. Shave or clip according to hospital policy, body hair if needed. 2. Wipe the skin with sandpaper for optimal adhesion. 3. Peel the sensor. 4. Place the sensor on the 4 quadrants of the body. 5. Attach connectors. 6. Secure the lead cables to the patient using the supplied adhesive tape, Tegaderm, or other similar products which you have access to in your hospital. The instruction card within the sensor package shows the proper application of Cheetah sensors. Note that you should place 2 sensors above the heart and 2 sensors below the heart. There are pictures on the sensors themselves directing you to apply to the upper and lower left and upper and lower right to better direct the sensor placement. Proper sensor placement is important for data collection. Be sure to properly prep the skin, as it is very important to obtain optimal signals. Cheetah sensors must be positioned around the heart. 2 sets of sensors positioned on the upper chest or upper back. 2 sets of sensors positioned on the lower ribs, flanks, or lower back. In selecting the optimal location for the sensors, consider the following. 1. For optimal signal quality, lateral location is preferred for the lower pair, especially in obese individuals. 2. Find a spot that is outside direct contact with ECG stickers, venous lines, surgical drains, and the external pacemaker percutaneous lead. 3. It is not necessary to place sensors in a precise location or to maintain symmetry between them. 4. You can also use tape to secure the leads to the patient. When monitoring during anesthesia or for long-term periods, apply Tegaderm type adhesive or other similar products to secure the lead in place. Other considerations for selecting the optimal sensor location include 5. Place lower sensors on lower ribcage at the level of the umbilicus. 6. For respiratory distress patients, sensors may be placed on the back. Movement from abdominal breathing may cause issues during calibration. 7. Do not place sensors in a skin fold, which will shorten the distance between paired sensors. As mentioned previously, there is a red indicator located on each sensor which directs proper sensor location. Always ensure the sensor is in the upright position with the small white tab pointing toward the patient's toes. For application of the upper set of sensors, please consider the following. Pacemaker AICD present. Place the sensor at least 2.5 to 3 inches from the pacemaker AICD. Placement over clavicle. Do not place sensor gel directly on the clavicle. Place both above or below, or you can straddle the clavicle if needed. If you place the sensor below the clavicle, ensure that you place the sensor above the heart. The sensor needs to be above the aortic arch, since Starling SV measures flow in the aortic arch. Finally, please refer to the following points regarding adequate sensor placement, replacement, and maintenance. 1. One set of sensors can be used for up to 48 hours. Be sure to use a new sensor set after 48 hours of Starling monitoring. 2. Sensor gel ensures good conduction between the skin and the sensor. 3. After 48 hours, the gel deteriorates, and there is a risk of inaccurate readings on the Starling SV. 4. Risk of skin breakdown if sensors are left on for more than 48 hours. 5. Date the change of sensors to track when sensors need to be replaced. The patient cable attaches the Cheetah monitor to the sensors which are applied to the patient. First, attach the patient cable to the back of the Cheetah Starling SV monitor. The patient cable location is clearly marked on the back of the monitor. Then attach the colored ends of the patient cable to the proper attachment on the sensors. The red attachment on the sensors goes into the red attachment on the patient cable. The clear attachment on the sensors goes into the black attachment on the patient cable. Once the attachments are secure, please secure the cable so that there is no dangling in the cable that may catch on other equipment or pose a tripping risk to other clinicians in the room. This concludes the Cheetah Medical Starling SV Proper Cheetah Sensor Placement Learning Module. Please refer to the IFU User Manual for additional user application instruction, troubleshooting, and maintenance information. Thank you.